Hello, and welcome to CARE's Cancer Rehab Ed and Support. Today, I'm breaking down what every primary care provider needs to know about cancer-associated venous thromboembolism, or VTEL, based on the latest 2023 ASCO Guideline update. First, why does this matter? Cancer patients are up to 7 times more likely to develop VTL. It's one of the leading causes of death in this population, but also one of the most preventable. As a primary care provider, I'm often the first to spot risk factors, manage comorbidities, and guide anticoagulation decisions before, during, or after cancer treatment. So, who needs prophylaxis? Let's break it down by setting. For surgery, all cancer patients undergoing major surgery should receive LMWH or UFH unless contraindicated. Extended prophylaxis up to 4 weeks is recommended for those having abdominal or pelvic surgery with high-risk features like reduced mobility, obesity, prior VTEL, or advanced age. According to the 2023 ASCO update, I can now consider Rivaroxaban or Apixaban after initial LMWH for extended prophylaxis, but this is a weak recommendation due to limited data. For ambulatory patients on chemo routine, prophylaxis isn't needed. But for high-risk outpatients, for example, those with a Corona score of 2 or more, I consider Apixaban, Rivaroxaban, or LMWH if bleeding risk is low and there are no major drug interactions. Treating VTL in cancer. Initial options include LMWH, UFH, Fondaparinux, Rivaroxaban, or Apixaban. I prefer LMWH over UFH if renal function is okay. For long-term treatment, Apixaban, Rivaroxaban, Edoxaban, or LMWH are preferred over warfarin. Apixaban stands out with strong evidence from the Caravaggio and ATOM VTE trials, lower recurrence and similar bleeding risk to LMWH. But with GI or GU cancers, I use caution. Mucosal bleeding risk is higher with XA inhibitors. Beyond 6 months for patients with active cancer metastatic disease or ongoing chemo-extended anticoagulation may be appropriate. I reassess risks and benefits regularly. Key takeaways. Know your cancer patient's VTL risk, especially around surgery or chemo. Consider DOACs like Apixaban when appropriate, but weigh bleeding risk carefully. Educate patients on signs of DVT and PE, and collaborate closely with oncology for shared decisions. You can find the full guideline at asco.org/supportive-care-guidelines. Let's work together to reduce VTE-related morbidity and mortality in cancer care. Thanks for watching. Subscribe for more oncology-focused updates for frontline clinicians. Stay informed, stay proactive.